Good afternoon, everyone. For those that are in the auditorium, we are preparing for our next event, which is our FEHB and Medicare seminar. And for those that have called in, we're kind of turning over the auditorium at this time, so please bear with us and give us a few more minutes to set up. Thank you.
Check 1, 2, testing. Check 1, 2.
It's on now, so you see that light up.
Good afternoon, everyone. I would like to welcome you to our Division of Pay and Benefits seminar series. Today we will be presenting on FEHB, the Federal Employees Health Benefits and Medicare. And we have something special for you all. Before we get started, wanted to go over just a few house notes. I'm sure you all know where the restrooms are, but straight outside the door to your right before you get to the lobby are the restrooms on the left-hand side. Also, we will have a question and answer period towards the end of the seminar. So if you have any questions, we ask that you please hold your questions until the Q&A period at the end. We will open up the floor to those here in the room that have questions, as well as those that are on the line. We do have a moderator that will be able to unmute the phone calls, so you can, phone lines, I'm sorry, so you are able to ask your questions that way. We also have a email box, so for those that are calling in, if you have any questions, you may submit your questions throughout the presentation to the email address benefitsseminars@cms.hhs.gov. Again, that's benefits with a S at the end, seminars with a S at the end at cms.hhs.gov. Again, you can submit your questions to that email address, and we will ask our presenters those questions during the Q&A period. So we have with you today two very special presenters that are employees of CMS in the Office of Communications. We have Kim Lair. Ms. Lair has been employed by CMS for over 15 years. She has worked in leadership in Medicare training development, delivery, and technical instruction since 2008. During this time, she has served in a variety of roles, including acting deputy director for the Division of Talent Development, the team lead for training technology for CMS NTP training specialist. Prior to 2008, she worked in the Office of the Regional Administrator, CMS, in Atlanta for outreach and education efforts. Ms. Lair has worked extensively to design and develop online training about common Medicare coverage choices in different personal situations, like 65 and still working. When is enrollment automatic, and immigrants and Medicare? To accomplish this, she has reviewed and researched Medicare coverage rules and regulations and programs operations manuals, and worked for a variety of Medicare subject matter experts. She has conducted seminars and webinars for CMS partners and beneficiaries, audiences, and developed appropriate training materials and handouts. Ms. Lair holds a Bachelor of Science from the University of Maryland in Business. We also have Ms. Carrie Watson. Carrie Watson has worked as an educator and trainer in the healthcare industry for over 20 years and is currently a health insurance specialist at CMS in the Office of Communications, Division of Training. Her experience has focused on designing and delivering education and training programs for a range of public and private organizations, including the Maryland Department of Health and Mental Hygiene, a Medicare health insurance plan, the Center for Healthy Maryland, and Humana. In these roles, she's had the opportunity to work with diverse populations within communities and organizations across Maryland, state and local government officials, the military, health plan and hospital administrators, healthcare providers, health plan members, and advocates. In addition to above, Ms. Watson is an experienced trainer who has worked on a range of Medicare training modules and advanced training topics. She has also presented on Medicare at the National Training Program Regional Workshops since 2016. Ms. Watson holds a Bachelor of Science degree in Health Sciences with a dual concentration in Community and School Health and Master of Science degree in Health Sciences, Healthcare Administration from Towson University. She has been a certified health education specialist by the National Commission for Health Education credentialing since 1997. Without further ado, I'm going to present to you Ms. Kim Lair, opening up our presentation.
Great. Thank you so much, Andrea. I appreciate that. I'm not used to such a formal introduction. Hi, I am Kim Lair, and I do work in the Office of Communications, as Andrea has mentioned. And my colleague, Carrie Watson, will be presenting the second half of the presentation. So this is Medicare and FEHB. We are going to get started first with some Medicare information, which I'm going to cover, and then I'm going to turn it over to Carrie to talk about how FEHB and Medicare can coordinate and work together. So I know when you came in, Carrie, my colleague, handed out, we call these responders or clickers. So if you don't have one, you can go ahead and raise your hand, and we'll make sure that we bring one over to you. What these are for interaction. We want you guys to be as much a part of this presentation as you can be. So we'll have some questions that will come up on the screen, and then you can register your answer with these clickers. And don't worry, we're not going to call you out if you have the wrong answer, but it's just a good gauge for us to know, if what we're presenting, is it making sense and are you understanding it? So for those on the phone, I apologize, we don't have a clicker through the computer, but we do want that ask that you go ahead and write your answers down when those portions of the presentation come up. So also, as we came in, we already received a couple of questions, which I'm sure many of you have. We are going to have a question and answer session, as Andrea outlined. We're going to go over general information. So we don't have access to anybody's personnel record or their work history. So certainly any of the questions that we bring up are going to be what applies in most cases. If you have very specific questions applying to your work circumstance, we are going to ask that you email us those that are very kind of more detail-oriented, that we have time to really pull together the right resources to provide you that information. Okay? All right, so before we get started, we have a couple of these word puzzles, which is up behind me. And it's just kind of a little brain break, a fun way to think of things. And so the first one is up. Any guesses of what it's representing? Health insurance, right? That one's easy enough. And let's not forget that both of these programs are, in fact, health insurance. So we're going to go through Medicare and the federal employees' health benefits. Before we get started on our slides, we want to make sure that we understand what you guys are coming here for, that we're addressing those points. So we want to take about 5 minutes for you to either reflect on your own or work with a partner and discuss the questions that you came here today when you saw this being advertised throughout the building. What was it about the title that you said, oh, I'm going to go to that session and I'm going to learn X? Whatever that might be for you. And that'll give Carrie and I a good kind of understanding. After a couple minutes, we'll ask if there's any brave volunteers that might want to share, just so that Carrie and I can have a good idea to make sure that we're touching and really focusing in on those points that you guys came here to get. Okay? And for those on the phone, please go ahead and write down what you want your learning goals to be. Any volunteers that want to share the biggest portion of information that you came to get? Yes, thank you very much.
Okay, for me, it's as I approach retirement and being eligible for Medicare, making that decision of what I'm going to carry with me after retirement. Am I going to go with Medicare? Am I going to go with the employer health plan that would live with me in a retiree state? So I have to make those decisions, so I need more information on what that'll cost me, and et cetera.
Excellent. So I heard her coverage choices, whether or not she's going to keep her retiree coverage, whether she should get it with Medicare, one or the other, and what are the costs associated with those choices. Excellent. Thank you so much. Anybody else would like to share? Thank you.
What I would like to share is I would like to learn more about my roles and responsibility as a health care giver for an elderly parent. So don't know those rules.
Excellent. I'm so glad you brought that up. So some of us are here considering our own coverage choices, but some others might be here in a caregiver role. just to get educated about the Medicare program and what supports and advice you might be offering to somebody else. Excellent. Okay, any other volunteers? Oh, one more here in the back.
All right, so I'm familiar with, because of family, I'm familiar with Medicare Part B and getting Medigap insurance, and also kind of sorting through whether you wanted the Medicare Advantage. However, no one in my family that I'm aware of has faced the choice of having the federal employee health benefit. And how does that fit in with Medicare, as opposed to what I'm more familiar with from past family is you get Medicare, either Part B, original Medicare, and Medigap, or you go with a Medicare Advantage plan. So I'm not sure how this third or fourth option works.
Excellent, thank you so much. And we will certainly get into those choices and how those of us that are in federal service have a very comprehensive program into retirement, and that does then impact our specific choices. So particularly in Medigap, you find that we don't have a whole lot of slides on Medigap, because for federal employees' health benefits, if they keep that coverage into retirement, then that coverage often acts as a Medigap plan. So in general, federal employees won't need a separate supplemental policy. So Carrie's going to go into that specifically later on, but we're not going to cover the specifics of Medigap because in general, federal employees don't need it. So thank you so much for sharing those learning goals. I'm fairly certain we're going to touch on all of them, so let's go ahead and get started. We're going to go into the Medicare basics. So if you don't know the basics of Medicare and Part B and Part A and original Medicare, then we're certainly going to cover that. Then once we understand what Medicare is, what it's going to cover, and what it costs, then when can you enroll in it? And what do those timing of those decisions, what impact might they have? And then lessons 3, 4, and 5, Carrie's going to come up and present, and that's really how Medicare might work with other benefits, say, for example, federal health insurance benefits. Okay? All right, so lesson 1, the Medicare basics. What is Medicare? Medicare is health insurance, right back to our word puzzle. We are the largest health insurance company in the world. It's health insurance for 3 groups of people, right? Those that are 65 or older, those with certain disabilities, and those with end-stage renal disease. Now, I'll just caveat this with, I know we're at CMS. As Andrea said, I've worked at CMS for over 15 years, but in the early part of my career, I'll admit, I could not tell you the basics of Medicare, because at CMS we have IT personnel, we have acquisition personnel. We do a lot of other things, and just because we work here doesn't mean that we understand these basics. So for some of you who do work on the program side, this is going to be a review of information you might already understand. But we didn't want to take that for granted because we know that there's a lot of other parts of the agency that do other things. So back to the basics. You'll see that there is an exception there for under 65 with certain disabilities. So what that means is if you've applied for Social Security disability benefits, you won't get Medicare right away. You won't get Medicare until you get that 25th payment of your Social Security disability benefits. That's when Medicare coverage would kick in under that enrollment type. There is an exception, though, for those who have Lou Gehrig's disease. There is no waiting period for Medicare. That coverage would kick in immediately. Okay, so that's why that sub-bullet's there for that exception. And then end-stage renal disease is defined as those with kidney failure needing a regular course of dialysis to sustain life. So those 3 groups of people are eligible for Medicare coverage. Okay, here are the parts of Medicare. Part A is hospital insurance, and we're going to go into each one of these in depth in just a moment. Part B we refer to as medical insurance. And then Part D is kind of the easiest to remember because D for drugs. Part D, you can add, if you want, prescription drug coverage. So if you notice, we skipped Part C, and it's not because we don't know our alphabet. It's because we're going to talk later on what Part C is also known as Medicare Advantage. And what Medicare Advantage does is it bundles these parts that you see up here on the screen, Part A, Part B, and usually Part D, into combined bundled plans offered by private health insurance companies, okay? So Part A and Part B is what's known as Original Medicare, and that's federal government health insurance, fee-for-service. You can choose to add Part D to your Original Medicare for your prescription drugs. Or the other side, which is called Part C, but not on this slide, is all of these things bundled together into one plan, and it's going to be operated out of a private health insurance companies that are overseen and approved by Medicare. Okay? So more specifically, what is covered when you have Medicare Part A? The thing that I want you to remember about Part A is the key term inpatient. Okay? Part A is going to cover inpatient medically necessary care. Inpatient is when a doctor submits official orders to admit you to the hospital. So when you have Part A and you're admitted, these are the things it covers. You can see there on the screen. The semi-private room, meals, the medications that you're going to receive as part of your treatment, and then inpatient skilled nursing facility care. Again, the key term is inpatient. So let's go into more detail. For Part A, if you have Medicare Part A and you have a hospital stay, you're going to get that room that we talked about on the previous slide, but also as an inpatient, if you need blood, you won't have to pay or replace it. You also, if you qualified for an inpatient hospital stay as approved by your doctor, but for religious beliefs, don't believe in traditional medicine, Medicare Part A would qualify you and cover you for the non-religious, non-medical healthcare institutions. So you can see there the abbreviation, the RINKIs. So if you would otherwise qualify for hospital service, but for medical beliefs, go to a different facility, then Medicare Part A does cover that. What's not covered? You can see there. The private duty nursing, a private room unless it's deemed medically necessary, a television or phone if it's as an additional charge. A lot of times that might be included with the regular fee and there's not an additional charge. In that case, it would be covered. And personal care items like razors or slippers or socks or those types of things. Also, not covered for Original Medicare is an inpatient hospital stay that's outside the U.S. Medicare coverage only applies to if you're in the United States. Okay? So what does Medicare Part A cost? We know what it covers. Let's talk about cost. And just like any other health insurance company, I always think of Flo from Progressive in that commercial with the insurance speak where she's translating on an island. There are some terms we're going to go over. I just want to make sure we're all familiar with them. Premium, you see up there, it's a monthly payment that you make to have insurance, essentially, okay? General term. A deductible is an amount that you must pay out of pocket before that insurance will start to pay, okay? A copay is your personal share of the insurance, and usually a flat fee, like $10, whereas coinsurance would be a percentage, maybe 20%. And again, that's your personal out-of-pocket expense, okay? So just wanted to clarify those terms before we go into the specifics for Part A. So for Medicare Part A, it's premium-free for most people. Now, what do I mean by that? If you've worked for at least 10 years of Medicare-covered employment, out of your payroll tax, you'll see a FICA tax, Federal Income Contribution Act tax. That's being taken out of your payroll to provide your Medicare Part A coverage later on down the line. So most people qualify for premium-free Part A, meaning they don't have to pay a monthly payment for it, okay? It can be based on your work experience or that of your spouse, okay? So for that reason, when people who have worked for at least 10 years become Medicare eligible, most people do enroll in Part A because you've already paid for it, because there's not a monthly premium associated with it. All right? But for Part A, if you're admitted by a doctor as an inpatient, you are going to be responsible for a deductible. And that deductible amount changes every year, and it's updated each year. And you can see there for 2019, it's $1,364 for the first days of your stay, days 1 through 60. So once you paid that amount out of pocket, then your Medicare coverage would kick in, okay? And you would pay nothing else after you've met that deductible until your 61st day in the hospital, and then you can see then you would pay a per day fee, $341. And then beyond 90, you pay $682. So that would be a very long hospital stay, but those are the costs, and again, they're updated each year. Okay? Another important point for original Medicare is there's no out-of-pocket maximum. And what does that mean? An out-of-pocket maximum means for that year, maybe once you've spent a certain cap, you wouldn't be expected to spend anymore. That does not apply to original Medicare. There is not an out-of-pocket maximum for Medicare Part A. Okay. So we said Medicare Part A is inpatient. But if you're in the hospital, how are you sure? How do you know whether you're an inpatient? What's the difference? Because a lot of people might assume if you're getting care in a hospital that you're an inpatient. But that isn't necessarily the case. You can be an inpatient, or you can be in a hospital under what they call observation care, right? Which means a doctor hasn't given orders to formally admit you as an inpatient. A doctor should admit you as an inpatient if they expect that you'll need 2 midnights or more of hospital care. Okay? They might not submit those orders and keep you for what they call observation if they expect that you would be released before those 2 midnights. Okay? This is important to know because we just talked about Medicare Part A will cover an inpatient stay. But if you're at a hospital and you're receiving care and you have Medicare Part A but you're not an inpatient, then you can't be assured that Medicare Part A is going to cover that cost unless you know that you're an inpatient. So if you're in that situation, you can certainly always ask, and we encourage people with Medicare to ask. Ask your doctor, ask your nurse, ask your caregiver to ask on your behalf. Because if you're not classified as an inpatient, Medicare Part A will not be covering those costs. The hospitals are required to notify you what we call a MOON. So it's an observation notice. They have to notify you in writing if you're in the hospital under observation care and you haven't been admitted as an inpatient. Okay, that's a legal requirement that they need to provide you because it's saying that you could be responsible for these costs. Okay? All right. Check your knowledge time. So let's get out of responders. Jim went to the hospital with chest pain. And he was in the emergency room for 2 days. Then his doctor wrote orders to admit him as an inpatient. He was discharged 2 days later. Jim's entire stay was covered by Part A, true or false, because he spent 5 days and 4 nights in a hospital. So put A for true, if you believe that's true, that Part A is going to cover his entire stay, or B, false. And again, those on the phone, please go ahead and write what you think your response should be. Okay, I see the responses coming in. All right, I'm going to go ahead and close the polling. And let's see how you guys did. All right, so we were split. Some people said it was true, and some people said it was false. And this is going to be false. Part A is not going to cover his entire hospital stay because he wasn't classified as an inpatient until 2 days after being there. Okay, so that's why it's really important for people with Medicare to know whether they're an inpatient or an outpatient. And that's why it's legally mandated that hospitals give them a written notice, a MOON notice, if they're an outpatient or in observation care in a hospital. Okay? I do see questions in the back. I'm going to ask you that you hold it for a quick moment because we're going to just try and go through and have a setup time for question and answer. But thank you. I appreciate it. Okay. All right, so there's our false. So as Part A, we said Part A covers inpatient care. We just went through hospital, which is a big portion of inpatient care. But it will also cover skilled nursing facility care, but there is a certain condition. Skilled nursing care is covered under Medicare Part A if you've been in a hospital in an inpatient status for 3 days prior to needing the skilled nursing facility care. So let's do an example. Say I need a hip replacement. My doctor's going to admit me for the surgery. I'm going to be an inpatient in the hospital for 4 days. After that, I don't need inpatient hospital care anymore, but I might need rehabilitation facilities or skilled nursing services. I'm not ready to go home just yet. So my doctor would submit orders for a skilled nursing facility. That would be covered by Medicare Part A because I just came from a qualifying 3-day inpatient hospital stay. And it's the same injury, and I'm going into a skilled nursing facility. Medicare Part A is going to cover that. If I was only in the hospital as an inpatient for a day, my skilled nursing facility stay would not be qualified. You need to have that qualifying 3-day in an inpatient hospital stay for a skilled nursing facility to be covered. The other important thing is the 30-day requirement that you see there. So let's say, the same example, I had my surgery, and then I thought I was good enough, me and my doctors thought I would be good enough to go home. And maybe after a day or two at home, I realized I'm just not there yet. My doctor can still admit me to a skilled nursing facility stay, and it will be covered under Medicare because it's within 30 days. Okay? But if I go 31 days and now all of a sudden I say I need care, it's not going to be covered by Medicare Part A because we're beyond that 30-day. All right? The other important thing is when you're looking for providers or hospitals and you have Medicare, you want to make sure that they accept Medicare, that they're a Medicare facility, because that will certainly impact their cost. Okay, so those are the conditions of requirement for skilled nursing facility care. These are the services that are generally included in skilled nursing facility stay. And an important thing to note is that skilled nursing care is covered under Medicare, not custodial or long-term care. So what do I mean by that? For skilled nursing care, it's the expectation that you're going to get better, right? With physical therapy, you're going to be able to get in and out of bed on your own after that hip surgery. But if you needed long-term custodial care and there's no expectation that you're going to get better, that is not considered skilled nursing facility. That's long-term care, custodial care. Okay. And you can see there some cases ambulance coverage is covered under skilled nursing facility Part A, or dietary counseling for things like if somebody had diabetes, those types of services would be covered if it's taking place in a skilled nursing facility care. What does skilled nursing facility care cost for somebody with Medicare out of pocket? Remember, you've already paid your Part A deductible from that related inpatient hospital stay. So once you would get admitted to a skilled nursing facility for that inpatient hospital stay, you pay nothing for the first 20 days. After 20 days, you'd pay $170.50 per day, and then beyond that, you would have all costs. So there is a limitation on the skilled nursing facility coverage for Medicare. Okay. This is another one of those word puzzles. We haven't gone over this yet, but we have it here as an introductory. We're going to go over it now. Any guesses? This one's pretty easy. Benefit period. Exactly. Thank you very much. So we just talked about what Medicare Part A costs, and those costs are per benefit period. And what do we mean by that? A benefit period is how Medicare measures services of inpatient care. And you would pay a deductible for each benefit period. So it's important to understand the difference and when you would be paying that new deductible each time. So a benefit period starts the day you're admitted for inpatient Part A covered care. And then it ends, it continues, because you pay your deductible, and then you're in that benefit period until you've been discharged and you don't need any inpatient facility care for 60 days. Okay? So in the same example we've been using, somebody goes into a hospital, an inpatient for hip surgery, then they go to a skilled nursing facility. Let's say they're in the hospital for 4 days, they're in a skilled nursing facility for 3 days. So there are 7 days in, that benefit period started. That benefit period would end 60 days when they no longer need those services. If after 60 days, they either experienced another injury or had to go back for inpatient hospital care, they would have to pay another deductible because they're beyond that benefit period. And the reverse applies too. If they get home after the 7th or 10th day and something's acting up and they need to be readmitted to the hospital, they would not have to pay the deductible because they're within the same benefit period. So you can see how it's important for people with Medicare to understand this because it indicates to you how many times you would have to pay that Part A deductible. Okay? And the benefit period is that 60-day time span. It can cross over calendar years. Okay? So just because you're in the hospital in, say, December, your clock starts counting from that inpatient, that first day of inpatient care, it's going to go ahead and carry over for the next calendar year until you don't need care for 60 days. All right? So let's give this one a try. Go ahead and pull out your responders, or if you're on the phone, get ready to do a true or false again. Michael was admitted to the hospital on December 30th, 2017. He stayed for 5 days, and he was readmitted to February 2nd on 2018, which is 29 days later. True or false? Michael had to pay 2 Part A deductibles because his care included time in 2017 and 2018. So go ahead and pull out your response clickers and vote. All right. I'm going to go ahead and close the polling, so if you have any last-minute additions, go ahead. A for true, B for false. Okay, it looks like the majority overwhelmingly got this one right. This is false, right? He still is within that benefit period. He did not go 60 days, 60 calendar days without needing care. So good job. All right, we're still in Part A. So we did inpatient hospital, we did inpatient skilled nursing facility. Part A also covers home health coverage, and there's 5 conditions for Part A meeting that home health coverage, and that's on the next slide. But you can see here what is concluded in home health coverage. It's intermittent skilled nursing care, physical therapy and rehabilitation care. What isn't covered is the 24-hour-a-day care at home, personal care, homemaker services, or meals. All right. And here are the 5 required conditions for Medicare Part A to cover home health coverage. You have to be homebound. And so what does this mean? Medicare defines this as needing extreme effort to get out of your home. To leave, you would need supportive devices, specialty transportation, or leaving your home would endanger your life. So that's what they consider homebound. That doesn't mean that somebody can't, say, go to church. So you can be considered homebound, but still have some exceptions where you might be able to participate in religious activities. So you can still have that condition of coverage. So here are the other 5 conditions that you need to the skilled nursing care on a part-time or intermittent basis, that you have to be under the care of a doctor, and then that doctor has to have a face-to-face encounter with you to continue to certify and examine to make sure that you still meet these qualifications. The interesting thing about home health coverage is it can be covered under Part A of Medicare, and then in some circumstances it can also be covered in Part B of Medicare. For example, we talked about Part A, you have that normally an inpatient hospital stay associated with a lot of this care. If you don't have that associated hospital stay, then Part B, as in boy, could kick in and cover your home health coverage. Okay. So now we know what it covers. What does it cost? In original Medicare, you don't pay anything for the home health coverage services. And the 20%, a lot of times associated with this type of care, you would need a durable medical equipment, or you'll hear around here, DME, a wheelchair, a crutch, something of that nature. That is generally covered under Part B, so that's where the 20%, I know we haven't gotten there yet, but this is what most people with Medicare would pay for home health care. All right. And then Part A still also covers, in addition to the inpatient care we've already talked about and the home health care, hospice care. And so what does it mean for hospice? It means that a doctor certifies that you have an expectation of 6 months or less for the remainder of your life. Once you elect hospice, it has to be written, so a signed election form, and all of your care then translate from focusing on a cure to really what they call palliative care, and they're making somebody comfortable. So the change of the kind of plan of management and the approach to your care changes when you elect hospice care. The doctor can, so if you do 6 months, a doctor certifies you and you've gone beyond the 6-month certification, you can continue with your hospice care election and it will still be covered by Medicare. The doctor just has to continuously recertify you every 6-month period. You'd have to select a hospice that's approved by Medicare. And you can see the covered hospice services under Part A up here on the slide. What's unique mostly about hospice care is there's some of the coverage, like grief counseling, is not really for the person receiving care, but it's for their family members. So hospice care for Medicare will cover grief counseling for the family, respite care. So if you have a caregiver that's around the clock, then Medicare will pay for respite care to allow that caregiver some time off and some relief. So those are some of the benefits that are really unique to the hospice care benefit. Okay. So what would you pay for hospice care? And again, you pay nothing in original Medicare. For some symptom control, you might need a prescription. You would not pay more than the $5 that's on the slide. And you can see that for certain examples, like the respite care example that I just gave, Medicare could cover room and board for those services. So if somebody's getting hospice care at home, and then to give a caregiver respite care, they might be moved into a different facility for a bit, then the room and board would be covered in order to provide that service. Okay. All right. That's Part A. The first half of what we refer to as original Medicare. So again, the big piece to remember with Part A is inpatient. That's kind of the big basket. So if Part A is inpatient, then Part B is kind of a catch-all for everything else. It's outpatient services, so when you take trips to the doctor. It's the DME we talked about, the durable medical equipment, if you're going through Medicare-approved providers. Things to keep you healthy, so preventive services are included under Part B. So that'll be things like screenings and flu shots, vaccines, and a lot of those are covered at no cost for the preventive services. It also includes lab tests, diagnostic tests, x-rays. That's all included under Part B. Part B is different than Part A. So we talked about with Part A, most people didn't have to pay a premium, right? It was taken out of our payroll tax. Most people get what we call free Part A. Part B is the opposite. Just about everybody pays Part B premium, unless you're in one of the programs for extra help for limited resources. So people pay Part B monthly premium. This year it's $135.50. So every month you would have to pay that Part B premium if you wanted to have Medicare Part B. There's also a yearly deductible, so the amount that you would have to pay out of pocket before your Part B coverage starts. And again, these numbers are updated each year. And when you go to a doctor, Medicare Part A would generally pay for about 80% of those services. The remaining 20% is considered your co-payment, your co-insurance. So for Part B services, you've got to think you're going to have the monthly premium every month, and it can be impacted by income. We're going to go into that into the next slide. And you would pay about 20% of the Medicare bill, of the doctor bill, excuse me. Medicare pitches in about 80%, and you cover the remaining 20%. Okay. So when we normally give this Medicare presentation, we say a very small percentage of people have to pay what we call an income-related monthly adjustment amount for their Part B premium. When we talk to federal employees, if you look at this income, you can see if you've been a grade 12 or a grade 13 for a number of years and are higher in the steps, this income chart can very well apply to you. So for people who make, and these charts are updated every year, and it's based on your tax returns that you filed with the IRS. And the latest record for tax returns would be 2 years ago. So most people, generally speaking, not federal employees, pay the Part B premium of $135.50 every month. If your income is above $85,000 a year, as filed on your IRS tax return for an individual, then you would move up in the bracket, and you start paying $189.60. Okay? And so on and so forth. So you can see the income charts, then the more that you have on your income as filed from the IRS 2 years ago, then the higher amount that you would pay in Part B. Okay? So sometimes in retirement or certain life events like divorce or when you change from an active federal employee to a retiree, you can have a difference in income. So if you have been given an IRMA, what they call an IRMA determination, meaning you have to pay more for your Part B, and you disagree with it, maybe a life event happened that you don't make this anymore, because it's from 2 years ago, you can contact Social Security, and there's a form that you can fill out. They'll ask for you to provide some information about that life-changing event, and they can adjust or make the decision to adjust this amount. Okay. All right. One more, sorry, I'm going to back up one slide because I forgot. For the 20%, remember we talked about for a Part B doctor visit, you're going to generally pay 20%, and Medicare will pay 80%. It's important that you talk to your doctor and select your provider and make sure they accept what we call assignment. So if somebody accepts Medicare assignment, it means they're not going to bill you for the extra amount. It means that if they accept assignment, they accept Medicare payment as payment in full. So that can make a big difference when you're choosing providers. If you have somebody with Medicare, if you can still see a doctor that doesn't accept assignment, it just means you'll generally have to pay more. All right? So sorry for going back. That's an important point, and I didn't want to overlook it. Okay, so the Part B premium. We just looked at the amounts and what you would pay or what it would cost each month to have Part B. You have options on how you want to pay this amount. It can be deducted from your Social Security, or for those of us, you can contact OPM and work to get it taken out of your federal employee retirement benefits. So you can see there you also have the option, if you don't want it deducted, that you can pay, and you can now pay online. I know mymedicare.gov is releasing that. So you can have options for how you want to pay your Part B premium. All right. All right, let's get out our responders. We have a kind of rapid fire quiz time. So we just went over what we call original Medicare. Part A, inpatient, and Part B, doctor services, preventive visits. The next couple slides, we're going to ask whether it's A or B. You're going to see a service and select A if you think it's covered under Medicare Part A, and select B if it's covered under Medicare Part B. Okay? For those on the phone, again, go ahead and jot down your answers so you can follow along. Medically necessary doctor's care. Is it covered under Part A, Part B, or select C if you don't think it's covered at all? All right, see those answers coming in? I'm going to go ahead and close the poll now. Yes, exactly. Most of you got this right. The answer is B. Medically necessary doctor's care is covered under Medicare Part B. All right. Next one. A medically necessary inpatient hospital stay. Select A if it's covered under Part A, B for Part B, or C for not covered by Medicare. All right, the answers are coming in. Closing the poll. Yes. Yay! Success. Great job, 100%. Yes. Part A covers medically necessary inpatient hospital care. Let's do the next one. What about a colonoscopy? All right. A for Medicare Part A, B for Medicare Part B, or C for not covered. All right. All right. Still good. That's still good. A colonoscopy is considered a preventive service. It's a screening. It's a diagnostic tool, so it's going to be covered under Part B. All right. Next one. What about acupuncture? Part A for Medicare Part A, Part B for Medicare Part B, Part C for not covered. All right, I'm going to close the polling to get those last couple answers in. All right, this one was kind of tricky. C, acupuncture is not currently covered under Medicare. There are demos and pilots, and Medicare continuously goes through and analyzes coverage decisions. And once they have enough data, there are certain times that they will change national coverage determinations. Currently, acupuncture is not accepted as Medicare covered service. Will caveat that, but there is a pilot or demo that is testing this for purposes of including it in a later national coverage determination, but generally no. Acupuncture isn't covered, along with a couple other important things that we want to make sure people know. Original Medicare does not cover dental. Original Medicare does not cover hearing aids. Original Medicare does not cover vision unless associated with another health ailment. So if you need glasses continuously, Medicare is not going to cover that. They would only cover glasses maybe if you had a surgery and then needed it as part of treatment for that healing. Okay, so those are important things. And we talked a little bit earlier, too, that Medicare is not going to cover anything outside of the U.S. So when you're making those decisions that we talked about earlier with our learning goals, if you're somebody who plans to travel a lot, it's something to keep in mind that you might want to make sure you have a supplemental coverage for those portions that Medicare might not cover. Okay? So now that we know what original Medicare is, how much it costs, what it covers, let's talk about, guesses? Enrollment, yes. Let's talk about Medicare enrollment. Medicare enrollment is not the same for everybody. It depends on how you're qualifying for Medicare, whether it's based on what we call aging in, or disability, or ESRD. It depends on if you're receiving your Social Security retirement benefits. It depends on your other coverage. Like if you have coverage through active employment from a group health plan. But why is it important that you know about enrollment timeframes? Because for Medicare, if you don't enroll by the identified cutoff enrollment period, if there's not a special circumstance, you could have to pay late enrollment penalties. All right, there's a late enrollment penalty for Medicare Part A only if it's not free. So for most people, Medicare Part A is free, so you wouldn't be looking at a late enrollment penalty. For some people, if you didn't work those 10 years of required coverage, you can still have Part A, but it means you'd have to pay a premium for it. And in those cases, if you don't join on time, you'd also have to pay a penalty for not joining when you were first eligible. Medicare Part B, if you don't join, can also have a late enrollment penalty, which would be a lifetime penalty. It's for as long as you carry Part B. All right? And then Medicare Part D for prescription drug, we haven't gone into that in specifics, but if you don't enroll on time and you don't have other source of creditable coverage, which is important, FEHB plans offer credible coverage, so most often this does not apply to federal employees, but there can be late enrollment penalties associated with Part D. Also, if you don't know when you need to enroll, you might experience a coverage gap, right? You don't want to have any period of time where you're not covered under a certain, under health insurance, because that could certainly be risky. All right. Some people are automatically enrolled in Medicare. They don't have to take any action. They don't have to call Social Security. If they're receiving disability benefits for 24 months, on that 25th month, they're automatically enrolled. It happens. If they are receiving their Social Security retirement before turning 65, at least 4 months before turning 65, they're automatically enrolled in Medicare. Okay? They don't have to do anything. They'll get a welcome to Medicare package in the mail. It'll have their card. It'll say you've been automatically enrolled in Part A and Part B. If you don't want to keep Part B, turn the card over, follow the instructions, mail it back, and we'll send you a new card. So they don't have to do anything. It's automatic. We're finding this is going to happen to less and less people. Why? The Social Security retirement age is going up. So a lot of people are delaying getting their Social Security until later in life. So less and less people are getting Social Security before turning 65. So what if you're not getting Social Security and you're turning 65? Are you going to get a notice from Medicare? No, you're not going to get notified by Medicare. You're not going to be automatically enrolled. So we really want people to understand that if you're not automatically enrolled and you're turning 65, you have to take an action to enroll. Medicare is not going to notify you. Okay? And so this is what we're finding. More and more people are delaying their Social Security benefits until later in life. So more and more people are having to take an action to enroll Medicare on time. So you're still entitled to Medicare, even though you're not taking your Social Security retirement benefits. As soon as you reach age 65, you can enroll in Medicare. So we administer Medicare here at CMS, but we don't enroll people, right? If you want to enroll in Medicare, enrollment questions, it's always socialsecurity.gov. The only exception to that would be if you work for the railroad, and then the Railroad Retirement Board handles that. So if you aren't automatically enrolled and you have to take an action, then you have to call Social Security, and they can help you in timing when you want your Medicare coverage to start. So we're going to go through these in what we call enrollment periods for those that need to take an action. We're going to go in each one in more detail in a moment, but just quickly, the initial enrollment period, you'll hear us abbreviate it to IEP. Okay, that's the 7-month period around your 65th birthday. So it's 3 months leading up to your 65th birthday, the month of your birthday, and then 3 months after. If for whatever reason you don't take any actions to enroll during your IEP, every year there's a general enrollment period that you can enroll in Part A and Part B. And then in some special circumstances, which we're going to go over again in detail, you're entitled to what we call a special enrollment period. Okay? First one is the initial enrollment period. This is generally what we call the best time to enroll in Medicare because you can be ensured that there's going to be no late enrollment penalties. This is your first option to enroll in Medicare. Therefore, if you're signing up during this time, you won't have any late enrollment penalties. This is the 7-month period around your 65th birthday. Your coverage depends on when you call Social Security to enroll. So if you were to call them the 3 months before your 65th birthday, you can ask that your coverage start on the month you turn 65. If you call during that month of your birthday, the coverage can start the next month. But if you wait until the last 3 months of your IEP, then your Medicare coverage is going to be delayed 2 to 3 months. But when you talk to Social Security, they can tell you, and they can tell you which options that you have for your Medicare coverage to start within these parameters. Okay? So you can see there, what can you do during your initial enrollment period? You can join Original Medicare, Part A, Part B. Once you have Part A or Part B, then you are entitled to choose Part D, which is prescription drug coverage. You need to have either Part A or Part B for that. For Part D, it's important, you're never automatically enrolled in Part D. You always have to choose a plan and take an action. okay? And then if you wanted a Medicare Advantage plan, which we'll get into a little bit later, you have to have both Parts A and Part B. That's the Part C. So you can enroll in anything during your IEP, and you can be sure there's no late enrollment penalties. Okay. If for whatever reason you did not enroll during your IEP, every year Medicare offers what we call the general enrollment period. Okay, so January through March, and then you can see there's a delay when your coverage would actually start. It wouldn't start until July. So if you missed your IEP and didn't enroll in Part B, you can use the general enrollment period to enroll in Part B. You can see the red box on the slide that there could be a late enrollment penalty because you missed your initial enrollment period. For Part A, you can see the parentheses, it's if you have to buy it. If Part A is free, we talked about most people have free Part A. Once you become eligible at 65 for your free Part A, you can choose to enroll at any time because it's free for you. So you wouldn't have to wait for an enrollment period. If it's not free for you and you have to pay a premium, you'd have to wait for the general enrollment period to begin your Part A. Okay. Now, this special enrollment period is particularly important when we're talking about federal employees because we're all still here actively working. If you're covered under other group health insurance like FEHB and you're still working when you become Medicare age, you are allowed an 8-month special enrollment period. So that means if I'm working, still here at 65, then I could choose to delay my Part B because I'm already covered under my federal employee benefit system. Now, why would I do that? Because I don't want to pay a Part B premium when I'm already covered, right? I have that ability to delay my Part B enrollment because I'm still actively working and covered by group health insurance. When does my time start for my 8 months? It's when I lose that coverage or stop working. Okay, so if I delay my Part B, say I'm still working here past 65, 66, 67, I'm still not paying for Part B, I'm going to retire at 68, and I'm switching my coverage. From that point, I have 8 months to enroll in Medicare Part B before I'm charged a late enrollment penalty. Okay, so it allows people to delay paying their Part B premium until they actually need the coverage. All right, so it's not for everybody. COBRA insurance does not count as active employment. You have to be actively working and covered under a group health plan to be eligible for this special enrollment period. Okay? All right, let's get at our clickers. A coworker tells you you need to enroll in Medicare Part B now because you turned 65. Otherwise, you would have to pay a late enrollment penalty. What's your response to your coworker? A, I'll get an SEP, or B, thanks so much for reminding me. All right, I think we get around 24 to 25 responses, so I'm going to go ahead and close the poll. All right, still kind of split. In this case, A, you should get an SEP. You're actively working past 65 and you're covered under group health insurance. You can delay Part B. You don't have to enroll because you'll get a special enrollment period when you lose that coverage or stop working. Okay, you'll have that 8 months that you could then pick up Part B without paying a late enrollment penalty. Okay. So we talked a lot about original Medicare, but Medicare, you have options on how you want to get your coverage. So we went over in detail this option here, original Medicare. That's Part A and Part B. We talked at the very beginning, Part C is Medicare Advantage. It essentially bundles your Part A and Part B, and most often drug coverage, or Part D, into one plan that's offered by private insurance companies. So you do have this option. Take a quick look. Original Medicare, your coverage options include your Part A and your Part B, which we went over. We know how much that costs. You can see the third bullet says you may need to buy supplemental coverage. This is the Medigap that somebody had a question about earlier. Supplemental coverage can also include coverage you might have from an employer, like federal employee health benefits. So in most cases, federal employees consider this as their Medigap coverage, and they don't need to enroll in a separate Medigap plan. There might be some exceptions. For the case we talked about, kind of travel, if somebody really wants, there's travel coverage options in Medigap, but it depends on what your federal employee health benefits might also cover that. But in general, most federal employees do not enroll in Medigap because their FEHB can act and does act as a supplement to Medicare. Okay. And then Part D is the prescription drug coverage. Federal employee health benefit plans all provide what we call creditable prescription drug coverage. That means it's at least as good as Medicare Part D. So in general, most often federal retirees that keep FEHB don't need to enroll in a Part D plan. Okay? So that's an original Medicare coverage chart, and those are the options. The other side is the Medicare Advantage plan, which we talked about. It's kind of those bundled options. Federal employees can choose, and Carrie will go into this in more detail, but quickly, you can choose to what we call suspend your FEHB coverage and enroll in a Medicare Advantage plan. But the Medicare Advantage plan doesn't necessarily work with your FEHB coverage. If you switch over, you suspend one in favor of the other. Okay? In general, the stats say that most federal employees haven't done this option because there's 3 premiums when you look at that option. So Medicare Advantage plans, you have to have Part A and Part B. Means you're paying a Part B premium. Your Medicare Advantage plan or your plan Part C plan can also charge a premium. So you might pay a premium for that. And then you have your FEHB premium. Now, some Medicare Advantage plans have a $0 premium, or they can offer what they call Part B sharing. So they would kick in some money to cover your Part B premium. So that's an exception. It depends on what plans are offered in your area. Okay, so for Medicare Advantage plans, it really depends on the plan. And then there is a resource at the end, it's called Plan Finder, that you can search by zip code to see which types of Medicare Advantage plans, if that's something you're interested in. Okay. One other caveat to Medicare Advantage plans is they have to offer the benefits of original Medicare. So the Part A and Part B services we talked about has to be included in Medicare Advantage. Their costs could be different, depends on the plan, but they have to offer those benefits. They can also add benefits to that. So they could cover things like maybe a gym membership or things that original Medicare doesn't cover. So that's sometimes attractive to people when making their Medicare coverage choices. Okay. And so with that, I'm going to go ahead and turn it over to Carrie, who's going to talk about how FEHB works with Medicare. Carrie?
Okay, it's like the 7th inning stretch right now. Everybody take a deep breath, process all of that, and now we can move on to what should I do now? Okay, so let me first ask everyone, by a show of hands, how many people were somewhat familiar with a lot of the basics of Medicare? Okay, that's a good bit of you. Good. And next question, how many here feel as though they kind of know what they plan to do for retirement when it comes to making these decisions? Okay, just a few. All right, well, good. And it is a very, long kind of process when it comes to like researching everything that you may need to know. So first, let's go over what we're going to talk about. And We're going to talk about, do you take Medicare Part A and Part B, or both? What's Medicare Advantage and FEHB? What do I need to know about that? Kim already talked about what some of the coverage is and what that includes, but when it comes to decision-making, what does it mean? And same goes for Medicare Part D and FEHB drug coverage. And lastly, we want to go into a little bit about the TRICARE for Life, and Medicare and FEHB. Is there anyone in here that is that has TRICARE? Okay, there's one person. And we don't go into a great deal of detail. However, as with anything else that we talk about, we are very happy to take very individualized questions following the presentation, or we have an email box that we will put up at the very end that you can definitely send questions to, specifically, circumstances that you may be in or things you may be considering. We can try to help you get the right information. So who should consider enrolling in Medicare Part A? So anyone who is 65 or older. You can be working or retired. And the good thing is most people who have worked, as many of you, would get Part A for free. So you would not pay a premium. So there's really, for most people, it's kind of a no-brainer. Like you just take it because you get it. And you would get automatically enrolled, as Kim was talking about before, if you are receiving Social Security benefits. And the other thing to mention is that you would need to enroll if you are still working. You would definitely want to enroll, take an active step in that enrollment process during your initial enrollment period, as Kim just talked about, which is IEP. That's that 7-month period around your 65th birthday. Okay. So who would want to delay Part A? I just said it was free. But there are some individuals who may want to delay it, and that's those individuals who have a high deductible health plan and it has a health savings account. And that's really the key point right there, the health savings account. You can't contribute to a health savings account once you have Medicare. And if you don't stop contributing at least 6 months before Medicare, then you could have some tax penalties. So that's really the biggest, I think, consideration for some people who are in that situation. And they would need to decide, which do they prefer. And you can get Medicare Part A later, as long as you, wait till outside of that time frame and you maybe decide to move on from that health savings account. And there's a note up here about an HRA, which is the health reimbursement account. Those do work a little bit differently. So if you aren't, or you weren't eligible for an HSA and you have an HRA, you can get Part A without those tax penalties. Okay, so that's a little bit different for those individuals. Okay, so we have another puzzle. Anyone want to take a guess at this one? Great, out-of-pocket cost. And again, Kim had gone into some detail about what all those various costs could be: premiums, deductibles, co-pays, co-insurance, lots of terminology there. And some of it you're familiar with from your plans that you have now. Okay? Now here's the big question that everyone wants to know, or they're trying to consider when they come of age, and they're trying to figure out, what do I do about Medicare Part B? Do I take it? Do I not take it? And again, one thing that we like to say is it really comes down to a personal decision. There's a lot of facts out there. There's a lot of information on the web from not just CMS, but from many, many different sources, brokers, et cetera. And you'll start to see, if you're looking that up, you'll start to see some trends of things that they all kind of, give you some common ground about, what things you may want to consider in that decision. And we'll go over a couple of those right now. So Medicare Part B may be a good choice for you. and it's definitely something that many will consider. The one thing that's really good is if you have Medicare Part B and FEHB, it's basically like complete coverage. So for things that may not be covered under an FEHB plan, like home health care is very limited, but in Medicare Part B, it's covered at 100%. So while you're not thinking that you need home health care when you turn 65 or retire, you have to kind of think ahead and kind of figure out what makes the most sense for you, basically. So definitely in consideration. And then FEHB plans, they continue to pay primary for things like prescription drug. And that's another thing. Those FEHB plans have prescription drug coverage, and as Kim mentioned, most of the time it doesn't make sense to also get a Medicare Part D plan. Okay, so consider Part B. Because they pay for those costs that, again, may not be covered under your FEHB plan. They would pick up the cost, and there's nothing additional that you need to do. They coordinate their benefits, and we'll get to some slides on that in a little bit. And the other thing, if you do have TRICARE for Life, it is required that you have Medicare Part B. That's one of the main times when it is required. So what if you're still working? Well, you have some choices. Most of the time, we hear people delay Part B because you're still working, so you have FEHB. And then FEHB continues to, work as it does, as you have it now. And then when you do decide to retire, you have a special enrollment period, as Kim talked about. So you have that 8-month time frame of when you can then make that decision to, either enroll in Part B or decide not to enroll. And then there's some forms here, and you have this in your packet as well. And then you can download the form from cms.gov, and you would need to get that completed by your, some of it from your employer. Just basically saying that, you were still employed, and that helps to entitle you to this special enrollment period so that you don't get those penalties. And that's really what we're trying to avoid, is any of the late enrollment penalties, as Kim was talking about also. And one thing I didn't mention is about the spouse. And I know that's a big consideration for a lot of people. So if you're still working, you're 65, your spouse age 65 remains covered also under FEHB, and they still that stays the primary payer for that person that's enrolled. Okay, so Medicare Advantage. Now, again, remember I said with TRICARE you needed Part B. Also for Medicare Advantage, if you wanted to have a Medicare Advantage plan, again, it's another way to get the coverage. It kind of functions like a plan like probably you may have now, but it's like an HMO kind of format. And that's just an option that you have out there. It's run by private companies, just like you're used to. You may have to use a special network, so very similar to what you may be used to. There's a key point on this slide that I think I want to draw most of your attention to, and that's you can suspend your FEHB plan if you want to try a Medicare Advantage plan. So the most important point here is you don't want to ever cancel your FEHB plan, because if you cancel it, you may not be able to get it back. And you don't want that. You don't want to be in that situation. So definitely, if you're interested in going that route, you can suspend. And then if you do decide, like say that you're in a Medicare Advantage plan and the plan isn't going to be available anymore, you would then be able to go back, either go to a different Medicare Advantage plan, or you could go back to your FEHB plan. And in that case, you would have to, re-enroll in that plan that you want from FEHB. And also, if you just decide you don't like the Medicare Advantage plan, you prefer your FEHB plan, you can still go back. It doesn't have to be like the plan's not in the area anymore for your, MA plan. But you would need to pay attention to the open enrollment timeframes and wait to enroll, and, it would start back up again shortly after. So what happens when you do suspend? You don't have to pay your FEHB premium, okay? So that's important to be aware of. But remember, when you have that Medicare Advantage plan, you do have to pay for the Medicare Part B in order to have Medicare Advantage. You have to have Part A and Part B to have Medicare Advantage. Let's see. We talked about some of this already. And with all of these decisions, it's always great, and I think Kim mentioned it as well, but talking to your benefits administrator, HR, getting all of the information, contacting OPM, and just making sure that everything that you're thinking about is accurate, so that you're, making the best decision possible. And if you suspend FEHB, the suspension of FEHB is effective the day before Medicare Advantage coverage begins. So it kind of just flows right into the Medicare Advantage plan. Part D. So Part D, as we talked about, most FEHB plans have prescription drug coverage. So for most federal employees, we don't need to have a separate Part D plan. But just to give you just a quick overview, it is available to all people with Medicare. You get it through the private or Medicare prescription drug plans. They're basically like private companies that run prescription drug plans. And if you don't get one when you're first eligible, you may have to pay a higher amount. However, as Kim was saying about the credible coverage, FEHB plans offer, their drug coverage is credible. So if you would decide, you would be able to get a Part D plan, but you may have this additional 1% added to your premium. There is one time when you may be interested in enrolling in a Medicare Part D plan if you are under an FEHB plan, and that is if you're a retiree and you have limited income and resources, you may consider that. So in that case, you would need to look at the income charts to determine, if you fall into that category, and you could apply for a program called Extra Help, and that would possibly be a good option for someone with those, that may be in that situation that has limited income and resources. Okay. Anyone? Yes, TRICARE. So, just a little bit on TRICARE. I know we have one individual here, but if you, happen to know someone, you may be able to share this information with them. If you're retired from the military, you must enroll in Part A and B, as I mentioned. If you're active duty, you don't need to have Part B to have TRICARE. You're still covered under TRICARE. And if you have TRICARE, you don't need to have a prescription drug plan through Medicare. And if you would have additional coverage, then the Medicare drug plan would pay first, and TRICARE would pay second. So that was really, really brief and to the point. One other thing about TRICARE is, there are individuals, they may have TRICARE, they may be eligible for FEHB, and then they become eligible for Medicare. So for those individuals, they really have like some great options for full coverage, and it's again going back to the decision making as to how you want to proceed. And there are some, actually, since we have someone here that is in that category, I just want to share one thing here. You can suspend FEHB enrollment to enroll in TRICARE for life, which is the TRICARE after you're 65 years old. And that would save that monthly premium of FEHB. So that's a pretty big benefit there. Okay, so moving along. I mentioned before about coordination of benefits and how do these plans work together. So as I said, with FEHB and Medicare, it's pretty seamless for you because first, let's talk about who pays first. If the good rule of thumb is if you're actively working, FEHB would be the primary payer, and then it would automatically kick to Medicare if there's any piece that's not covered under FEHB. If you're retired, Medicare would pay first, and then FEHB would be billed. So again, it just works both ways, depending upon your employment status, basically. And then if you're receiving workers' compensation, workers' comp would pay first. So since we do have a fair number of people that retire from federal service and then get reemployed, we did include this information because if you're in that situation, do we have anyone that's been reemployed in this room? No? Okay. Well, if you end up being reemployed, again, if you're reemployed in a company that and you're eligible again for FEHB benefits, then FEHB would be your primary payer. And if you're in a position that makes you not eligible for FEHB benefits, then Medicare would just continue to be your payer for your bills. Okay, so these are really the key takeaways. So this one, I would circle this page. These are some key points. So again, Medicare Part A, it's not required, but recommended if you're still working and have FEHB. Again, if you've worked and you have your years of service, Medicare Part A isn't costing anything. It's great to let your health plan know when you turn 65 for coordination purposes. And a lot of times, it's good to talk to your FEHB plan because for some individuals, one thing that they realize is that they become eligible for Medicare and they're paying that Part B premium if they choose to do that. And then they're paying their FEHB premium and they realize that Medicare picks up what FEHB doesn't. So they often can decide, well, I don't really need that FEHB plan. I want one that's a little less expensive. And you do have the option to change plans 30 days before you're eligible for Medicare, before you're 65. And again, during open enrollment, you can always make those changes to your FEHB plan to save a little bit of money. You can delay Part B with no penalty as long as you're still employed, which that's the key words there. And if you decide against Part B and later on decide, well, I'm getting older, I'm having some health problems, I really think I need Part B. You can definitely decide to enroll in Part B, but you would have to take a look at the late enrollment penalties and make a decision as to whether or not that would makes sense for you to take that on because it would be a higher premium amount. And then again, Medigap, which are the supplement plans, and Medicare Part D are both probably not needed for most federal employees. And, unless you're in a unique situation, you most likely wouldn't need those. Okay. So there are a lot of resources out there. So I encourage you to definitely do your homework, which I'm sure you will do. And we've just really covered the surface on many of these issues here. We have a lot of information on CMS.gov. We have a lot of information on Medicare.gov. If you're just looking for some basic Medicare information, coverage information, we use Medicare.gov often because it's simply written. So it's a great place to start. There's many publications out there on Medicare.gov as well. The Benefits Coordination and Recovery Center, I put that on here, and same with Medicare Secondary Payer. These are really to help you figure out, for secondary payer, help you figure out, if you have a question about who pays first. But the Benefits Coordination and Recovery Center, they are who looks at the other kinds of coverage you have and make sure that the right entity is getting billed first. Obviously, Social Security Administration, because those are the individuals down the street who do the enrollments. They have a lot of information on their website as well. OPM, link is here. There are a couple great resources that they have. One booklet in particular has a pretty thick booklet that goes through all of the common questions that, they've put together over the years that people have asked because they're pretty common. And they give some pretty straightforward answers to help people in their decision-making process. So I'm going to stop right here for a moment, and I want you to think back all the way to like 1:05 today. And some of you, we asked you to write down, record what information you had hoped to learn today. And now we're going to ask you, did we touch on it? And while I realize there are definitely some specific circumstances in here, in general, did we cover some of the basics that you're looking for? Show of hands. Anyone? Basics? Okay. And how many people still have a lot of questions? Some. That's not too bad. But yeah, that's to be expected, actually. So that's good. I'm glad you were brave enough to raise your hand. And again, we included the resources. I would caution people, there is a lot of broker information out there that you may want to just, I hate to say not to look at it, because sometimes I take a look and I think, oh, that's pretty helpful, the way it's written, like it may be written in a different way that resonates with you. But sometimes you just want to make sure that it's completely accurate. That's the one thing I would say about that. We do have a training mailbox, training at cms.hhs.gov. It comes directly to a few of us that open that mailbox. So for those of you who have those very specific questions, I would encourage you to send us an email. If there's something we can help you out with, we certainly will, or at least point you in the right direction. So we, tend to have a lot of contacts in these areas, so we can, do the best we can to get you to the right place. And before I open it up for questions, I have a few here that I wanted to share with you that I had already gotten today, and some of you in the audience asked some questions. So I wanted to make sure I address those first. Okay. First question is, are there any restrictions with having a flexible spending account and Part A? And the answer is no. You can have a flexible spending account and have Part A. Where it gets difficult is the HSA, okay, that health savings account that, you could have those tax penalties if you have that kind of plan now that has a HSA. You would want to end that 6 months prior to enrolling in Medicare so that you don't get hit with any of those tax liabilities. Next question is, someone asked if you can suspend, because remember we talked about suspension of FEHB plans. Can you suspend an FEHB plan if after you retire you get reemployed outside of the federal government, private entity, and you are offered employer insurance, so you think, well, let me just take that, because that way, if I'm still employed, I may not have to enroll in Medicare if I'm actively employed. And the answer is that you can only suspend FEHB if you're retired and enrolled in an MA plan or in Medicaid or TRICARE. So that's the quick and easy answer to that. Another thing is, do FEHB plans and Medicare cover the same types of expenses? And we kind of talked about that, but just as a recap, FEHB plans, one thing that they do that Medicare does not is they cover for emergency care outside of the United States. Some FEHB plans also have dental and vision care. depending upon your plan. And also, on the flip side, Medicare covers some orthopedic and prosthetic devices, durable medical equipment, home health care, limited chiropractic services, and some medical supplies. So there is some variability there between FEHB and Medicare. Next one is, let's see. Do I have to take Medicare Part B? And we kind of, hit the high points on that, but just as another recap, some advantages for having Part B is that there's a coordination of benefits between Medicare and a FEHB plan, which is there, and it lowers your out-of-pocket cost. Also, some FEHB plans waive its co-payments, co-insurance, and deductibles for services that are covered by Medicare Part B. And then also another one is if you're enrolled in an FEHB HMO, you can possibly go outside of your HMO network for Part B services and receive reimbursement by Medicare. So it gives some flexibility to where you're getting your care. There was one more. Oh, I'm retired with FEHB and Medicare coverage. I'm also covered under my spouse's insurance policy through work. Which plan pays first? So since you're retired but covered under your working spouse's policy, your spouse's policy is your primary coverage. Medicare will pay secondary benefits, and your FEHB plan will pay third. Okay. Let me just make sure there wasn't another thing I wanted to read off to you here. Oh, will my FEHB premiums be reduced if I enroll in Medicare? And they will stay the same. However, you do have that option, as I mentioned before, if you decide that there's another FEHB plan that's more affordable for you, you can change to another FEHB plan, either that up to 30 days before you're 65 or during the open enrollment period. So, and I think we have one more puzzle. Any guesses? Right, peace of mind. And I think this is really important because one thing that we get asked all the time, or the biggest consideration that folks have is, should I take Part B because I'm paying for my FEHB, then I'm going to pay for my Part B. And again, it goes back to what's your comfort level. Some people, they like getting the Part B because they know no matter what, this is the most that they're going to spend per month. They're going to pay their FEHB, they're going to pay their Part B, and there's, usually that full coverage. For some individuals, it's a big expense, so they have a lot to consider, and they think, well, how can I, can this work with FEHB, and I can either delay or just not take the Part B. So peace of mind comes into effect is what's your comfort level, and then kind of take it from there. So, and so with that, we will take questions between Kim and I, and if there's anything that we are not absolutely certain of, we will either ask you to email our training mailbox, which I'm going to put that slide back up, and it's in your packet, or we will get other contact information and try to figure out how best to help you. So. And we ask you, there's a mic up here, but if you're in the back part of the room, Kim also has a microphone.
Hey, and Carrie, I'm going to jump in because I had somebody that tried to ask a question earlier, so I wanted to give her their opportunity since I asked her to delay.
Thank you. Great presentation. I just wanted to know if you were, if you're an ESRD patient, you get a kidney transplant, are you still considered an ESRD patient? And would you still be covered? And how long?
Yeah, let me see on that one, because there are some special circumstances for individuals with ESRD. So hang around, and I will get with you after,
So-
or I have the information up here, but I just don't I want to make sure we can get some other questions. But
Right.
that is a great question.
In general, if you're qualifying for Medicare based on ESRD and you receive a successful transplant, there is a waiting period, and that's the one piece that I'm not certain of, but I want to say maybe 30 months. If 30 months have elapsed
Yep.
and you're still successful, then you would come off of Medicare coverage because you lose that eligibility, unless you qualify under a different basis. Now, it might be 30 or 36 months. That's the piece that I would like to verify on the time. But so if you have a successful kidney transplant and you no longer, you meet that time frame, you would come off of Medicare. If after that time period, then you have to go back on dialysis, then you could re-qualify based on ESRD later. Okay. Sure. And now I know there's some people standing at the mic.
Okay, next.
If you choose to, so you retire and you choose not to sign up for Part B and you have FEHB, if you later decide to sign up for Part B, is the penalty waived because you had the FEHB, or do you have to pay it?
If you're actively employed,
No, retired.
so you're retired and you say you're 65 or 67, you're, let's say 65, it's easier to kind of explain. You're 65, you're retired, you have your FEHB, you're like, I don't know, I want to wait on this Part B. You would have a penalty later, and it's 10% for every full year that you don't have coverage. 10% of the premium. So depending upon where your premium falls, Kim showed the chart with we call it IRMA, but it's the adjusted amount based on your income. You would look at that total amount and add 10% to that for every full year, and then that penalty stays with you. It's a lifetime, yeah.
So, okay, thank you.
Yep.
Before the next question, I'm sorry, I don't want to jump in. If I see some people are walking out, before you leave, please don't take your transponders. They won't open your garage or change your TV. So please give them to me before you walk out if you have to go somewhere. Thanks. Sorry.
Okay, at risk of embarrassing myself, but I think someone else in the audience might have the same question. So right now on our, like an active employee, I'm paying my FEHB premium, and of course, we pay a portion and the government pays a portion. I'll just say, like, maybe it's split 50-50. I pay $250, the government pays $250. Now, when we retire, is that still say the same? The government still?
You should stay the same.
Okay, so I'm thinking that provides a little bit of comfort, because the FEHB is going to be under active employees, the large pool of government employees. There's limits on what their insurance can go up.
Right.
Yeah, okay. So that's a huge peace of mind.
Yeah.
Yeah, okay.
Yep. Okay.
Hi. When I'm 65 and I'm already enrolled in Part A.
Okay.
When the time comes and I'm ready to retire, and I'm in this period to enroll during the 8-month special enrollment period, this form that has to be submitted, CMS L564, the employing office completes it.
Right. It's basically they're saying, yes, this person was employed. They're not just making it up, you know.
So is this a form that I can walk into an office while I'm still employed here and in the building, and I have access here?
I'm not sure, like, the time frame. Kim, I'm not sure if you know the time frame on, like, how soon it can be completed.
So that form is actually submitted to our division.
Oh, okay.
The Division of Pay and Benefits. So you would submit that form to your servicing benefits specialist.
And that person would be in the Division of Pay and Benefits?
Yeah, it's your servicing benefits specialist in the
And they're
Division of
usually
Pay and Benefits.
Assigned to your office or your center?
Correct.
Okay.
Yeah. And so I would just say, if you needed the form completed, to email them first, because in order to complete the form, we have to verify that you've had coverage. So it's not just giving us the form and we sign off on it. We actually have to review your personnel records to make sure you had the FEHB coverage. So I would just, send a email or a phone call to your benefits specialist just to say, I have this form. That way they can do the research prior to you coming and then be able to fill out the form and then give it back to you.
And what is the time frame you usually suggest to allow for completion, and how soon can the individual bring it to you or send it to you?
Well, like I said, if you were to email them or call them, the form can be completed right away. I mean, it's right away. So if we know ahead of time and we're able to do, review your personnel records just to make sure you had that FEHB coverage, and then once you come, we can go ahead and sign off on it and give it right back.
Okay.
So it's
Good. Quick.
Yeah, it's relatively quick turnaround.
So when I get to the place where I'm planning to retire, I'd probably be contacting my specialist at the division in advance of my planned retirement, because there are other questions I have to engage before retirement. Could this be part of that conversation?
Yes. Yes.
Okay. Thank you.
First of all, thanks for a great session. Lots of really good, meaty information. I wanted to make sure conceptually I understand something and then ask about experience. So conceptually, if you decide when you're Medicare eligible that you want to go for original Medicare, is one way of looking at it thinking that the FEHB is really like a Medigap? I mean, it covers it covers the rest of your benefits that Part A doesn't cover.
Right.
Okay, thanks. And then second question is, so I'm not there to the 65 mark, and the fact that they will automatically enroll me, and I saw the jolting information about what the premium was, I was like, that's pretty important to keep track of. And if you get the card in the mail, and they say you have to return it to the Social Security office, my question is, how much do you guys know, or do the ships know, about how frequently that whole transaction gets messed up? So say I decide I don't want Part B, do they take certified? It's a really nitty-gritty question, but I could see how it could have some pretty expensive implications. Do you hear about that being a problem?
I have not. It seems like majority of the people now are working longer. So not as many people are getting automatically enrolled. In fact, we kind of have the opposite, especially not necessarily federal employees, but individuals who, in the general public, who don't know that they have to take an action to enroll, and therefore maybe they don't enroll, and then they find out that they should have enrolled, and then they're like facing a penalty because they didn't enroll on time. So, but getting back to your question, I can see what you're saying, and I don't know if that's something that happens. Kim?
Yeah. I don't have any actual statistics from maybe our ships or our partners about how often that would happen, but again, less and less people are being automatically enrolled. So that's tending to going down. And keep in mind, you would get your Medicare card within your initial enrollment period. And in order to keep Part B, you have to be setting up a premium payment, right? You'd have to set up a Medicare premium payment.
Right.
So if you didn't pay for your Part B, then you again would be Medicare would, I'd imagine, would be following up with you, or you wouldn't have Part B coverage because you're not paying the Part B premium. But ideally, that would happen still within that 7-month time frame because you're getting your initial enrollment period right at the beginning of your IEP. So I'd imagine that even if you missed somehow the notification with the card and saying, okay, return it if you don't want Part B, that's just the fact that you didn't set up a payment would prompt that further discussion.
Thanks, that's very helpful.
Yep, that's a good point. They
So
want
Kim
their
and
money.
Carrie, we have about 10 minutes left in our presentation. Do we want to try and open up the phone lines to see if we have any calls?
Sounds good. Go ahead, Mark.
Okay. Brianna, could you open the phone lines, please?
I sure can, but just to give you a brief disclaimer, a lot of people who joined the call are call-in users. and there may be some background noise. So are you guys still comfortable with unmuting all of the lines?
Yeah, that will be fine.
Okay,
And if someone isn't speaking, if they would mute their phone line, that would be fine.
perfect. I was just getting ready to say that.
All
For all
right,
those who are not asking questions, please keep the lines muted on your end. I'm getting ready to unmute all of the lines.
So do we have any questions from regions 1 or 2? We'll take 2 regions at a time.
I have a question.
Go ahead.
Yes, could the presenter repeat the point about what you pay for your FEHB plan after retirement?
So the plan premium should remain the same once you retire. The main thing is that you would also, if you take Medicare, have in addition the Medicare Part B premium.
So it's the amount, sorry about that computer noise. It's the amount that's currently taken out of your paycheck.
Right, correct.
Okay, thank you.
I have a question. Could the presenter just repeat, if you're employed with the government and you have health insurance and you're still working or retired, and your spouse is covered by your insurance for insurance purposes and still works, do they have the same waiting period for Part B? I didn't understand that too well.
So if you're still working and you're getting FEHB, as long as you're actively employed, you remain on FEHB. You can take Part A because it's free. But if you wait on Part A, the only thing it would do is provide additional benefits. If you wait on Part A, there's no penalty for Part A, taking it any time in the future that you decide to take Part A. If you decide to take you want Part B, you wouldn't need to do that until you're either not employed anymore or retired, however you want to frame that. So if you're retirement's coming up and you're like, okay, well, now I have a special enrollment period upon retirement, an 8-month time frame where you can enroll in Part B with no penalty. And I would like to just add to that, though, while we say there's 8 months, we strongly encourage people to enroll as soon as they can in that 8-month time frame, just to make sure there's no gap in coverage for them. And some individuals who, for some reason, have COBRA. COBRA is not active current employment. So if you have...
I didn't understand. What I was saying was not myself personally, my spouse, who's covered under my insurance. If she works beyond 65 and doesn't want to take Part B, does she have the same rights as I do to wait?
Spouses are a big one. So, make sure I have this correct. She's above age 65.
Covered by my insurance.
Covered by your insurance. And then you retire?
I say I retire.
And as long as she's above age 65, she would then no longer be covered under, like we call it a group health plan or FEHB. If you're in the private industry, group health plan, she would have a special enrollment period to get the Part B.
But that's what I want to reiterate. In other words, this is just not for me, for everybody. If I'm retired or actively working, if my spouse is still working at 65 and does not want to elect to take Part B because that spouse is covered under my health insurance plan with the government, my spouse also has that waiting period, that special waiting period.
Yes.
Thank you.
Yep.
Any additional questions in Region 1 or 2? We'll go to Region 3 and 4. Any questions? Region 5 and 6.
This is Region 5. Is it possible to get a copy of the packet somehow?
Yes, you can email benefitsseminars@cms.hhs.gov, and we'll be happy to send you the slides.
Oh, because this was on 17th.
Any other questions in Region 5 or 6?
Yes, actually. You know, would you repeat that again? You were going awfully fast, and I missed some of that address.
It's benefits seminars. Benefits with an S, seminars with an S at cms.hhs.gov.
Thank you.
Okay, this is Region 5, and I have a question. My husband is I'm currently working, and my husband is on my FEHP, and I want to know, he's retired and on Medicare. So do the same things that you were talking about, the Medicare Part B coverage and all of that, I should go ahead and do the same things as I would do for myself?
Okay, we have a facility.
In other words, get Medicare Part B coverage for him?
And by the way,
So you said he's retired, but you're still working?
Yes, that's correct.
Okay.
And he's under my insurance, on our insurance plan with me here. He gets Medicare Part A, and so should I get him Medicare Part B for the same reasons that I would get it for myself when I retire?
That's the important point. I wasn't sure if you were talking about retiring or not. So because he's under your FEHB plan and you're actively working, he also will qualify for that special enrollment period we talked about with the 8 months. So you can delay his Part B enrollment until you retire. And then again, you and him, the same time frame would apply, that 8-month special enrollment period in which you could enroll in Part B without the late enrollment penalties.
Well, I've always...
And also, just to clarify on that, there are some people who, when they're in that situation, they are used to being on the same plan, like a same FEHB plan as husband and wife, let's say. When they do decide to get Medicare, they can, again, get that special enrollment period, but they would have individual Medicare enrollments. So I just wanted to make that clarification.
Okay, thank you.
You're welcome.
I'm confused, but I'll talk to somebody one-on-one. I think this was kind of confusing. Thank you.
You're welcome.
Any additional questions from Region 5 or 6?
Well, but...
Region 7 or Region 8?
I have a question.
Go ahead.
Yes, I want to make sure if I plan, say I'm 66, 67, plan on retiring within the next 6 months, I still have that 8-month enrollment plan after I retire in 6 months, or do I have to get that before I retire?
If they haven't billed Medicaid...
So the special enrollment period, once you know your retirement date, like if you have that, you can start to pre-plan, but you do have that 8-month period from the date of your employment ending to enroll in a Medicare Part B plan, or Medicare Part B.
Right, so I think, and Carrie had said, you can call Social Security anytime within that 8 months. And so even as early as the first month of that 8-month time period and say, hey, I want it to kick in on this date. So there's nothing that prevents you from calling early on and working with Social Security about when you want your Medicare to be effective, as long as you're within that special enrollment period.
Correct, and that's important too. I'm glad you mentioned that. I was talking about a gap in coverage, but it's, again, to emphasize the point, making sure that, that timing is worked out so that you know when your coverage is ending from the employer, FEHB or the when that time period ends from retirement, your retirement date is what I'm trying to say. And then when you want the Medicare to start, because you don't necessarily want to start too soon if you don't want to pay that extra, monthly premium if you don't need it yet. So.
Oh. All right, thank you.
You're welcome.
Region
Are you
9
taking
or...
full-time teleworkers?
I'm sorry, repeat your question?
Are you taking questions from full-time teleworkers?
Sure. We've go ahead and ask your question.
Okay, not a question.
You skip Region 9 too, so come back when you're ready.
Okay.
The question has to do with, I am the spouse of a working government employee, and I'm also a government employee, but we both do not take separate health benefits. I plan to retire before he does. I'm going to continue on his benefits, like you said, But I thought the government had a program when you retire that you can continue on a government insurance and take your Medicare A, use the government insurance for your B coverage, basically, and then you can delay B as long as you want or never get it. Is that true?
It's just active employment. So
you don't get government coverage after. You can't keep this FEHB going in another capacity then after you retire.
No, you can keep your FEHB into retirement, and you don't have to enroll in Part B. If you choose not to enroll during that 8-month special enrollment period where you would lose, when you retired or you ended your active employment, you don't have to get Part B, but if later on in life you change your mind and you do enroll in it, you would be subject to the late enrollment penalties, okay? And it would go back and count for when you were first eligible for Part B.
So basically you're saying you can have all three if you wanted. You could get covered A, B, and the government one as well if you chose to. Okay, thank you. Just as it was unclear. Thank you.
All right, we'll come back to Region 9 or Region 10.
I had a question. We may have missed it. Did you talk about the situations where you using the minimum retirement age where there's actually a gap where you retire and then you wait X number of years or something till you hit that age and then you can get your FEHBP again? How would that be impacted by kind of the story and decision process that you talked about?
I am going to ask you to send that one to our mailbox because I'm not quite clear. I'm not quite clear on the question. And unless everybody else has something similar, I'm not quite clear on the question. So if you could email us at training@cms.hhs.gov. I'd like to make sure I'm understanding and I can get you the right answer.
Any additional questions from Region 9 or Region 10? Any questions from anyone who may be full-time telework? That includes employees in headquarters? No? Okay. Brianna, we'll go ahead and close the phone line. If you would make the phone lines again, appreciate that. And then Carrie and Kim, we've gotten a lot of requests for the slide material, which I've been over here feverishly sending out. So that should be covered for you. I do want to let folks know that we'll have a copy of the slide material and a copy of the recorded live stream session on the DPP webpage. So give us a couple of days and we'll get the information, the material we'll make the material available. I also have several questions in our inbox, and I think given the time, I'll forward those questions to your training mailbox, and then folks can look for a response from your training mailbox.
Absolutely. Yes.
Okay. All right.
Yep.
So, and I think we have one final question in the room. Is that okay?
So this is interesting. What about the other plans, not the FEHB plan, but like the plans for vision and dental that we can buy through our federal benefits that's not an FEHB? Like I have MetLife and I have another plan. And we're eligible to take them into retirement also?
Yes. Yes. Yes.
Yes, that's easy enough. Yes, yes, you can.
Okay.
Yeah, there's, just a side note, there's no eligibility requirement for plans, dental and vision plans covered under benefits. So for retirement, FEHB and FEHB, you have to have it for you have to be enrolled, whether your own policy or under your spouse's policy, for at least 5 years immediately preceding your retirement. There is no requirement for the dental and vision plans under benefits.
Wow, because I never heard anybody talk about that, but I talked to some retirees. I actually stepped out and they said that's one of the things they did. Because if you have Plan B Medicare and you have the FEHB, it covers everything except for the vision, the dental, and the hearing.
Right, you're right. No, and I think that's why we don't really address it because it's not covered under Medicare, but I'm glad you brought it up because that's something important we should remember to consider.
That's huge.
Yeah.
I think that's huge. Okay.
Yeah, yeah. Well, thank you for those of you who are still hanging in there. We appreciate your participation, and please, by all means, if you think of other questions, you may forward them to our mailbox in your slide deck, and Have a great day.
Yeah. Let me just make a mention of one thing. We're going to be doing a Division of Pay and Benefits will do a webinar. It's a series of webinars, but specifically we'll be doing one on the retirement planning or the retirement application process. So a lot of things that Andrea mentioned and questions that you have related to Medicare and FEHB into retirement will be discussed during that webinar. The first one will kick off on April 11th. There is a CMS-wide broadcast on this webinar series coming out in the next couple of days. So I think that would be helpful.
Great.
Okay.
Thanks.
Thank you.